HLP 103.5 FM, New Haven's home for community radio. I'm Mubarakah Ibrahim, and this is Mornings with Mubarakah. We are streaming live from the Beaver Hills section of New Haven, Connecticut. Want to welcome you to the show. You can find us on newhavenindependent.org. Tune in radio, just look for WNHH. We're also on Facebook and Periscope and Tune in radio. We are a little bit of everywhere. So if you are not sitting in one place for this show, you can just switch channels and continue to listen. But if you miss any of the show or any of the previous shows, or if this show is just so amazing that you have to listen to it again, which it's going to be, you can always find all of our past episodes podcasted on iTunes and SoundCloud. Just look for WNHH and New Haven Independent. I want to welcome to the show Dr. Ginger Nash. Thank you for joining me.
Awesome. Thanks to be here. Thank you to you, Mubarakah. It's a great pleasure.
Awesome. So today we are talking about natural and holistic health. Now, if you have followed me for any amount of time, you know that I think that natural is best. Holistic health is the foundation of what we as human beings need to rely on. And medicine is the alternative. So I actually don't really like talking about a holistic health, herbs and food and movement as alternative, because I kind of think medicine is the alternative.
I agree 100%. I love that. I've always disliked, as a naturopathic physician being called an alternative physician. No, that's exactly. No, I get it completely.
So one of the things that in the middle of the pandemic, that the first thing that everybody, which I think is a great thing, began to rush to is actual natural medicine, right? Mm-hmm. So when people realized that a lot of people were going to get coronavirus, and a lot of people already get other things like the flu and the cold, and everything is in one big winter season. Yes. It all came at the same time. People started really looking at ways to prevent themselves from getting sick, which is an awesome thing. So I thought that it would be great to actually talk to an expert, because we have the bittersweet internet.
Yes.
And
yes.
Everything that you read on the internet is not always true. And everyone wants to be a doctor on the internet and give advice. So we are actually going to talk to an actual naturopathic doctor to find out the ins and outs of the immune system. So let me tell you just a quick little thing about Dr. Nash so that we can jump right into it. Dr. Nash earned her doctorate in 1998 from the National University of Natural Medicine in Portland, Oregon. She has operated a general medical practice in New Haven, Connecticut for over 20 years and specializes in women's health and chronic immune dysregulation. Dr. Nash also lectured and taught healthcare programs for practitioners of natural medicine throughout the United States and Canada for many years. So Dr. Nash is the person to ask. I'm going to try to actually look at Facebook and see if we get any questions along the way.
Okay,
so
great.
I have some questions, and if you have questions, then unfortunately, Facebook is the only platform I'm going to be able to look at. So hop on the New Haven Independent.
That'll be enough. That'll be enough. Well, I love what you said as an introduction, Mubarakah, which is, there's so many unknowns about this COVID virus. And it's only been around for a few months. So, the researchers, the scientists are doing their best to learn as much as they can quickly. And of course, we've had some other SARS viruses in the recent past, and we know that there'll probably be more. This is unfortunately not the last pandemic that we will experience. Hopefully we'll be better prepared next time. But as a naturopathic physician, our training and our job is really to help improve the body's innate strengths. And one of the things that we do know already about this particular virus, even though there's so much we don't know, is that the healthier you are, the less likely you will be vulnerable to infection and the severity of the disease process. So the fundamental pillars of health are super important in terms of, how to, manage this when you do get exposed, because you're absolutely right. Like, it's not going away anytime soon. And most of us will be exposed. Many of us have probably been exposed and may not have had severe symptoms, and don't really even know if we've got immunity and how long that immunity will last and all that. We can get into that later, but we do know that some pre-existing conditions, which predispose to more severe infections and more complications, are things like cardiovascular disease, diabetes, and chronic respiratory diseases. So those folks that have, and immunocompromised folks, those folks that have issues, chronic issues, which is, of course, a lot of the things that naturopathic doctors do is treat chronic illness. I mean, I'm not positioning myself here as like, hey, I'm a doctor who treats an acute SARS-CoV-2 infection, even though I have had patients that have tested positive. My job is to keep them out of the hospital and to keep the underlying health as strong as possible so that the disease doesn't become, very severe and obviously result in death, because that's one of the things that does make this virus different from the battery of influenza viruses and flu viruses that we've been exposed to, is that there's definitely a higher mortality rate. And that's obviously what's put into position these social distancing practices and stay-at-home measures that we're all living through.
One of the things that that you pointed out is your job is to hopefully keep your patients out of the hospital.
Absolutely.
And one of the, I think that in everybody's kind of like effort to do this, we talk a lot about, or the buzz is immune system, immune system, immune system. So right. I want us to break it down from the very base. Yeah. Can you define for people what exactly is your immune system and what it does? Because
okay, how much time do we have?
This is a really interesting thing to me as I'm reading people post. I'm like, you don't even know what the immune system is.
Yeah. Well, the immune system is very complicated, right? It's a very complicated system. And of course, one of the things we've been hearing so much about is this cytokine storm, which is an overreaction of the immune system. So it's very confusing for people because there's two main branches of the immune system: the innate immune system and the adaptive immune system. Your innate immune system is the one that jumps into quick action as soon as you encounter something that is non-self, that is not part of you. Your innate immune system should, spark into action and recognize that you've been exposed to a pathogen, either a bacteria or a virus or, some type of insult from the outside world. And that means that you can activate things called macrophages and certain type of response, which is more like a carpet bombing type of effect. So it's non-specific. It doesn't have specific antibodies, which is what the adaptive part of your immune system does. So the adaptive part is going to be the one that kicks in a little bit later. So it doesn't necessarily jump into action as quickly, but as you have been exposed to these things, the immune system should identify or tag certain viruses, bacteria, et cetera, pathogens from the outside world. And then that signals to the adaptive immune system to make a specific antibody to that invader. So it's a lot more like a targeted defense rather than an innate defense. And, naturopathic doctors and people into holistic health like yourself, like we think a lot about the innate immune system because that relates to things like barriers, like the health of our skin and the microbiome, all the beneficial bacteria that are in our gut, so that when we eat food, our body has the protective layers that it needs to not ingest, dangerous chemicals and dangerous pathogens, bacteria, et cetera, and that can pass out through the natural routes of elimination. So your innate immune system relates to sort of like the first line of defense. It relates to the barriers. It's really important in terms of sort of general reaction and general immune strength. Now, obviously, if you have a problem with that, your signaling isn't going to work. And that's one of the dangers of this SARS-CoV-2 virus, is that it messes up the signaling effects of the macrophages. It messes up some of that. And so the innate immune system isn't necessarily able to form a reaction so that there can be specific antibodies formed.
Yeah. Now, when it comes to the immune system outside of SARS, what are some of the most common and not so common things that compromises the immune system?
Well, the number one thing that comes to mind is stress. And we are all dealing with various levels of stress right now, whether it's the social distancing aspect and financial stress. Of course, we know that this is an economic crisis on par with the biological crisis. And so stress can actually play a huge role in secreting certain hormones that suppress your immune function and that lead to chronic inflammation. So one of the things that I'm always educating my patients about, and I'm sure you're educating all of your fitness clients, is that we need to build resistance, or resilience rather, in our systems, in our immune system. So the ability to respond to stress is what's so important, and not fly into this overreaction where all of your hormones, all of your immune inflammatory processes, kick into high gear. And one of the best ways to create resilience in terms of stress is exercise, regular exercise. So, it's obviously, good for your heart, good for your bones, good for your circulation, all of that, but it's also good for your immune system to be regularly exercising and creating that ability of the body to cope with stress, because exercise is a stress, right? You're putting a stress on your muscles, on your tissues, and then over time you become, conditioned. And so your body knows how to deal with stress more effectively. So exercise is really important. And also there's a recent study out of Sweden, which I was just reading about this morning, actually, which I think is fascinating, measuring the effects on brain function, on the hypothalamus in particular, about spending time in nature. And they designed this study with using both smell and visuals and sounds. So they used bird songs, just like a warbler bird song, and the smell of grass, and some sights in nature. And they found that, and this was a virtual experiment. It wasn't even done in actual nature. So that's one of the things I've been really encouraging people to do responsibly, wear a mask and all of that. But if you can get outside, if you have access to nature and the natural environment, that's going to be one of the best ways to reduce your stress right now, especially when you can't get hugs from your loved ones that you're not, quarantined with. So stress is a huge player in immune dysfunction. And then also, of course, things like I mentioned earlier, some underlying chronic conditions and including autoimmune conditions can really put a, challenge on your immune system, but also just chronic infections.
And so define that for people, because that's a word that is said a lot, autoimmune. And so what does that mean to have an autoimmune condition?
So an autoimmune condition means that your body's immune system is reacting to something that is self. It's confused and there's cross reactions. So a very common example is rheumatoid arthritis or Hashimoto's thyroiditis. Those are probably the two most common autoimmune conditions. So in rheumatoid arthritis, the body is reacting to the joint capsules, the synovia, the connective tissue around the joints. And so you get destruction and inflammation in the joints, even though your body shouldn't be creating inflammation in that area. There's a confusion in terms of that, as I said earlier, that specific immune response. So that's one example. And thyroiditis is another, where the body is forming antibodies. The immune system is making antibodies to your thyroid gland. And then that can cause, a slowdown in your overall metabolism and a whole bunch of other symptoms and signs that go along with that autoimmune condition. And then there's a lot of other conditions that are thought to have an autoimmune component. Then there's a whole slew like Sjogren's and lupus and, indiscriminate autoimmune disease. I treat a lot of Lyme disease and chronic infections and co-infections of Lyme. As we know, living in Connecticut, it's pretty rampant here. I mean, you can develop an autoimmune arthritis post Lyme disease. So there's a lot of different ways that they can manifest these autoimmune diseases, but a lot of the times the basic underlying mechanism is that you're making an antibody to a tissue in your body that is part of yourself and that you shouldn't be reacting to.
If you have an autoimmune disease, then your immune system is already compromised.
It's compromised in a certain way, but a more accurate way to say is it's not regulating properly. So you can get an overreaction in the immune system in some respects and an underreaction in some respects. And that ties back into, how complicated our immune systems are. And then the other issue for folks that are diagnosed with an autoimmune disease is a lot of them are on immunosuppressive drugs. So there is a relationship between some of these drugs and a low white blood cell count. White blood cells are one of the main actors in that immune system. The macrophages that I mentioned earlier, they are one of the types of our white blood cells. And there's neutrophils and all types of other white blood cells that can be depleted when you have the need to take one of those immunosuppressive drugs. Okay. And then also, again, back to chronic infections like Lyme and co-infections, Bartonella, Babesia, Ehrlichia, all things that are in our environment all over the place. They can also deplete your immune system over time too, if your body hasn't been able to form an adequate immune response and fully eradicate that infection. And this is one of the things that is really concerning about the SARS-CoV-2 virus as well, is that we're just beginning to understand what the long-term effects of the infection are, because we know that some people do end up with lung damage, with kidney problems that may be, affecting their bodies on a longer-term basis, even after they clear the acute infection. So that's something I'm sure there's going to be a lot more research into. Pulmonary fibrosis has already been noted, which is a thickening of the lung tissue that can diminish your lung function, over the long haul. So, it's really, really important, to practice these safe measures, because we just don't know so much about who is at the highest risk at this point and who may have, the problems that may lead to long-term damage. So, yeah.
So let's talk a little bit about what we can do. So we know we can exercise, we can reduce stress, which we have to make definitely intentional effort to do that, right?
Absolutely.
Because we are bombarded with all of the news and social media and everything else that is impacting our lives around stress. So the stress factor is really high. We got to make intentional effort. Let's talk a little bit about some of the ways in which people can actually make their immune system stronger. So my first question is, when we talk about ways to make immune system stronger, does it vary based on if you already have an existing immune dysfunction? Does somebody with an immune dysfunction need to do different things than people who don't have an immune dysfunction?
Yeah, absolutely. And that's a great point to say at this juncture, that I'm not giving medical advice to anybody. And if you have a diagnosed autoimmune disease or any type of immune issue, even things like asthma or chronic pulmonary disease, you really need to work with a practitioner, because it isn't safe to just take a lot of these things willy-nilly without understanding what your individual dosages and recommendations would be. So, that's a great way to just get into some of the things that are safe for everybody, which is a healthy diet. I mean, that's one of the things that I know you are super passionate about, and so am I. And one of the best ways that we can improve our immune function by lowering our risk for chronic inflammation, which is really the underlying driver of the problems. Of cardiovascular disease, of diabetes, of, some of these chronic respiratory diseases, is to just eat a very whole foods based healthy diet that includes some really specific nutrients that have been studied. And there's research coming out about a lot of different nutritional um, components. And we can definitely talk about some of the things that I'm, using for my patients. But again, you'll have to work with somebody to what your proper doses would be. But there are already some studies coming out about certain nutrients. But let's talk about diet first, since that's something that everyone has access to, is food, hopefully. And unfortunately, not everyone does have access to healthy foods. And that's one of the real tragedies, and one of the real issues with this current pandemic is the fact that folks that don't have access to preventive care and healthy food are the most vulnerable to the disease, and are also the people that are most exposed. If they have to go to a job where there's contact with a lot of individuals. So I just did want to mention that as well, before we get into the conversation about diet. Okay. So, one of the things that I've been talking a lot about are bioflavonoids and important anti-inflammatory components in certain foods. So, there's a compound called quercetin, which is found in a lot of different healthy foods. I have been recommending for years, actually, an onion soup to people that is just fantastic. Onions and scallions and leeks and tomatoes and apples. And what are some of the other foods that are really high in quercetin? Grapes, lettuce, asparagus, all these things are really high in quercetin. And quercetin has a really wonderful antihistamine effect and a really wonderful anti-inflammatory effect on the immune system, with specific affinity for the lungs and the respiratory system. So I did a lung cleanse a couple of years ago in the fall, and this onion soup was something that people were really experiencing a lot of reduction in respiratory issues, and in supporting the immune function of the lungs. So that's one component. Also, we've heard a lot about vitamin C, of course. Vitamin C has long been known to support the immune system. It's got a really lovely antioxidant effect on the body. So that means it's lowering those inflammatory molecules. And, lots and lots of foods are rich in vitamin C, a lot of fruits, of course. So berries and pineapple and pomegranate, elderberry, one of the things that, we've heard a lot about in the news. And I know you mentioned, Mubarakah, that people are wanting to bathe in elderberry. And, there is definitely some really good studies that report a reduction in inflammation. There was one contradictory study that came out that then people were worried that it could potentially contribute to that cytokine storm, but that was really kind of misunderstood and overblown. And elderberry has been used for many years, actually, to reduce the ability of certain viruses to attach to the lung tissue. So remember earlier when I said that the innate immune system has to do with the barriers in our body, which is including the gut, of course, and the mucosal lining of the gut, but also of the lungs. And so elderberry is a really important berry that has certain components that can help prevent the attachment of certain viruses to the lung tissue.
So the elderberry is more than just about the vitamin C it contains.
Yes, absolutely. It's absolutely. So it can, it hasn't been studied specifically with COVID, but it has been studied with H1N1, which was another virus that we were all talking about a few years back. And it's also shown to have some benefit for thinning mucus and helping a lot of excess mucus leave the body. So, elderberry is popular for a reason. But of course, again, if you have an underlying condition or a diagnosis that you aren't sure if it's going to interact with medications that you might be taking, et cetera, you need to be careful with that. But it definitely has an effect on this whole series of molecules called the inflammasome. As does green tea, which is another thing that I love to recommend. Green tea, either in the form of just drinking the tea or using matcha powder, which is also really popular and has even more higher amounts of a component called ECGC, which is just an amazing anti-inflammatory and actually helps regulate the cell's ability to replicate healthily. One of the things we haven't really talked about, but the real mechanism behind a virus being able to infect you and really cause tissue damage is that the virus has to attach to these receptors on the outside of your cells. And we know that this ACE2 receptor is the main one that this SARS virus is attaching to and binding to. But then it has to get inside your cell and hijack your own cell's DNA. And then it has to break out of the cell after it's infected that cell and then go around the body and actually infect other cells and cause damage. And this is why, we've seen kidney problems, we've seen blood clots, we've seen lung problems, of course. And we know that the SARS virus, the SARS-CoV-2 virus, is also infecting people's guts, and that we've seen it in stool samples as well. So it is getting into all these different parts of the body. So green tea is back to green tea is a wonderful way to support healthy DNA replication. I used to call it anti-cancer in a cup because it's got a really amazing effect on inflammation. And then it's also got some L-theanine in it in conjunction. There is a little bit of caffeine in green tea for those people that are caffeine sensitive. But it also has L-theanine in it, which is a really wonderful calming amino acid and can help with stress reduction and anxiety reduction. So it usually doesn't cause the same kind of caffeine sensitivity that something like coffee would cause, because it's got this other component in the plant. And then other components that are beneficial in the diet are found in the brassicas family. So that's things like broccoli and cauliflower and kale and Brussels sprouts and kohlrabi, cabbage. All of those things also contain really wonderful components, vitamins, minerals, nutrients that can be anti-inflammatory and really help your body prevent, again, severity of disease, even if you were to be exposed. And
so
can inhibit.
Let me ask you a quick question. Just thinking, so you've mentioned anti-inflammatory a couple of times. How does anti-inflammatory connect to the immune system or preventing illness?
Yeah, so anti-inflammatory means that it's going to block the activation of these inflammasomes in the body, which is part of the immune system. When you get a lot of inflammation, you have a worse outcome. That's really the worsening outcome of the viral infection. And that's why things like pre-existing conditions like cardiovascular disease and diabetes are conditions that are showing that you have a lot of inflammation in your body. So these same foods that I'm talking about as supporting your immune system and supporting your ability to resist an infection with this virus, they're also good things for your cardiovascular disease, for your asthma, for your diabetes as well.
Okay.
So foods that are anti-inflammatory usually have a lot of antioxidants. And one of the easiest way to think about this is foods that are colored, right? That are rich in color. And this is why we talk about the rainbow plate and getting purple foods, getting red foods, getting orange foods. This is why sweet potatoes are better for you than regular white potatoes, and why blue potatoes are even better than white potatoes. They just have more nutritional content. They have more phenolics. They have more antioxidants and more anti-inflammatory compounds, bioflavonoids, things that support your circulation. So, if you don't want to learn all the biochemistry, just look with your eyes and,
Yes.
pick foods. Pick
I
foods.
always tell people, when you look at your plate, how do you know you have a healthy plate? Is that you need to have at least 3 different colors on your plate.
Right. And one of them should be green.
Right. I'm going to start adding that. And one of them should be.
Yeah, definitely. 3 different colors. One has to be green. Yeah.
I love it. I like
that.
Yeah,
totally. So, these are things that everyone can do safely. And of course, if you have access to farmers markets, and I love, one of the silver linings of this whole pandemic has been to see how people are trying to get more local foods, more foods from, farms that are setting up ways to get food to people, donating to food banks and that type of thing. So, hopefully people have access to some of these healthy foods that are actually should be less expensive, right? Organic food should be less expensive than commercially raised foods. It's just that with the rise of industrial agriculture, they have all these subsidies that, for their water and pesticides and all that, which is really tragic. And hopefully, again, another silver lining that comes out of this is that we need to change the way we are, producing our foods in this country and around the world. I mean, this is very likely the result of industrial agriculture and raising animals. And, that's a big problem in terms of our food chains. But that's a digression. Yeah. So do we have any questions from the audience on Facebook about any of the topics that we've hit on so far? Or
someone wants to know, what is the best brand of vitamins to buy?
Well, that is something that cannot be answered simply, sadly. And unfortunately, the stuff that you find in the regular drugstores are nowhere near as good. There is a huge, huge spectrum of supplement quality. As a naturopathic doctor, this is something I've spent many years, researching and recommending. And there are some things that, are more important to have certain forms of, and some things that, you can get in your diet. One of the things I haven't touched upon yet, which is actually one of the most important and most researched nutrients that I do recommend very often in a supplemental form, because it's hard to get enough in your diet, is vitamin D. So vitamin D, you do want to have a D3 form, and it's often most beneficial for absorption in conjunction with K3, vitamin K. But vitamin D has already been studied in relation to this SARS-CoV-2 virus, and we know that people with a severe vitamin D deficiency are the people that are most prone to mortality and severe disease. So they've seen patients coming into the hospital, I think it was like 73% had severe vitamin D deficiency. So vitamin D is probably number one most important.
Is it because vitamin D, what does it do for your immune system?
Great question. It's actually kind of misnamed. It's not technically a vitamin. It's more of a prohormone, and it has a very complicated metabolism, but it is profoundly anti-inflammatory. So again, back to this whole anti-inflammatory piece that I've been talking about with food, vitamin D has a huge effect on inflammation in the body. So, that's something you definitely want to.
What are some of the food sources that people can get vitamin D?
Yeah, so some nuts and seeds have vitamin D. Eggs, organic eggs have vitamin D. I'm not a big proponent of cow's milk dairy, although it does have vitamin D. Some people, especially blood type B, can use dairy safely. But for a lot of people, cow's milk can be pro-inflammatory. So, dark leafy greens have a little bit, but organic eggs are really a good place. And some dairy that's tolerated by folks can also be a good source of vitamin D. I find that some whey-based dairy products like feta cheese and ricotta and fresh mozzarella are not as pro-inflammatory for a lot of people as the sort of harder cheddar cheeses and Monterey Jack or those types of cheeses. And then the very hard cheeses, again, like Parmesan and Romano, those can be tolerated usually better by people because they have some other components in them that aren't as inflammatory. But yeah, vitamin D, it's hard to get those adequate doses from the diet alone. So it's definitely something I have recommended. Also, zinc is another supplement that has been talked a lot about in terms of this particular pandemic because it does have a benefit for the immune system. It ushers certain molecules into the cell that makes the virus less able to replicate. So it's got a benefit in that way. So does pomegranate, actually. Pomegranate is another food that can be safely used that prevents replication of certain viruses. So that's another good one. Another thing that I've been recommending as an anti-inflammatory supplement is melatonin. So people think of melatonin as something that we use to support sleep. Melatonin is a hormone that is high at night when we're sleeping, and promotes good, deep, healthy sleep. But it's also got an incredible amount of research behind it in terms of regulating T cells, which is part of that specific immune system, and lung tissue, specifically in acute respiratory disease, which is one of the things that the COVID-19 pathology is doing, is causing this acute respiratory syndrome. So melatonin, you have to use it in kind of higher doses than you would use for sleep, but it is a very safe nutrient and molecule to use. So, I have been recommending that as well to people. And oral intake is usually around 3 to 6 milligrams for a few weeks, and that has shown to reduce blood levels of a number of inflammatory markers in people with diabetes, people with multiple sclerosis, people with cardiovascular disease. So there's a really good amount of science behind melatonin as well.
So we have a really good question. Are these supplements also recommended for children? Should children be taking them as well?
Well, the blessing in this whole pandemic, right, is that children are not as susceptible. And one of the reasons, and I would always be really careful in terms of supplementation for children. Children have much higher levels of antioxidants naturally. They haven't had as much damage to their tissues as we adults. They haven't done as many damaging things with their diet or smoking or alcohol and consumption, all of those things that
they haven't ruined their body yet.
Yeah, exactly. Yeah, you cut to the chase there, Mubarakah. So, children, I mean, I would say if you're feeding children a good, healthy, whole foods diet, maybe a little extra vitamin D. And if you have a doctor that's willing to test the vitamin D levels in your child, that might be a nice thing to do. Zinc is also very safe for children. But really, I would work with a practitioner or just use a very good multivitamin if you have concerns that your child is a really picky eater and doesn't eat a lot of high quality foods, which a lot of kids don't. I myself lived on, bologna and Devil Dogs and Wonder Bread until I was like 20. So, I certainly understand the picky eater phenomenon. There are some really good quality multivitamins for children. I always recommend that you either get your vitamins from a health food store or a naturopathic doctor or somebody that's well versed in nutrition, just because, like I said earlier, the stuff at unfortunately, CVS and Walgreens and Costco that's really cheap is not necessarily the best forms of vitamins, the most absorbable, et cetera. So you need to do a little bit of research in terms of that. And the same is true for probiotics. There's a lot of ways to get beneficial bacteria through the diet as well as, just supplementing with them. So when that's possible, I always like to, I'd rather have somebody eating a healthy diet than taking 20 pills, which I'm sure you agree with wholeheartedly as well, Mubarakah.
For sure.
Yeah.
So, since you brought up probiotics.
yeah. Let's talk about probiotics.
So talk to me about what probiotics are. So 2 buzzwords, probiotics and prebiotics. Break them down for us.
Yeah. So probiotics are any bacteria that has been identified to play a good role in your gut and immune system. So maybe some of your listeners don't know, but I would assume a lot of them do since they've been following you for a while, that we have trillions of beneficial bacteria in our digestive tracts and actually through the lining of all of our mucosal membranes, our sinuses, our ears, on our skin, etc. So probiotics are bacteria, like the common ones are Lactobacillus acidophilus, a bunch of Lactobacillus species, Bifidus, Saccharomyces boulardii. Some of these are the most common and most popular probiotics that have been identified and encapsulated. But there are actually over 700 probiotics. That it's just that not a lot of them come in supplement form. And they play a huge role in our immune system, actually, because there is a whole set of tissue called the gut-associated lymphoid tissue or the mucosal-associated lymphoid tissue, the GALT or the MALT. And this is our first point of contact with the outside. So, of course, there's a lot of protection in the gut, lymph tissue and lymphocytes that will identify anything that's pathogenic or bad for us, hopefully, when our gut is working healthily. And when we have adequate amounts of probiotics, we're going to be able to absorb our nutrients. We're going to be able to get rid of the bad guys, and we're going to be able to keep some of the bad guys from overgrowing, like yeast and other pathogens that can invade and infect the gut. So prebiotics are the food for the probiotics. So there are prebiotic substances like chicory and inulin and things that are found in foods that will support certain yeasts, brewer's yeast, for example, that will support the beneficial probiotics in continuing to grow and propagate in your gut. So some probiotics have a combination, some supplements have a combination of prebiotics and probiotics. Some are just the probiotics alone. And then some probiotics are spore-based, which is some of the recommendations that I've been making in the last, I would say, a couple of years. I've used a lot of probiotics for many years, but I've started using more of the spore-based probiotics, which means that they have a little bit better ability to survive the stomach acid and get down to the lower intestine, which is where most of these beneficial bacteria reside, is in your large intestine. The small intestine has a little bit of them, but your stomach and the upper part of the GI tract is really not the place that you want to have a lot of bacteria. You want to have a lot of bacteria in your large intestine. And of course, our stool is over 50% made up of bacteria. So we eliminate bacteria on a daily basis. Hopefully everybody's going once a day. And we ingest a lot of probiotics in our foods as well. And people are probably familiar, yogurt and other fermented foods, fermented vegetables, from, sauerkrauts that are made with live cultures, fermented carrots, fermented beets. You can even buy some of these things now in the health food stores, but you can also make your own with starter kits at home. Kombucha is also another popular food item that is rich in probiotics as well.
And I think it's important to note that it's a part of this conversation because 70% of your immune system is actually in your gut.
Right.
And so your probiotics, your gut bacteria is going to be absolutely essential in you maintaining a healthy immune system. And it's been to so many other diseases, including things like depression and anxiety. Really, it's an entire universe now that they're realizing we have a whole universe inside of our gut.
Absolutely. And it's funny you mentioned even things like depression and mood disorders. My colleague, Dr. Tara Nayak, loves this word psychobiotics. So psychobiotics are probiotics that have been shown to have an effect on mood. So there are actually certain probiotics that will have an effect on your anxiety levels, on your depression. There's some really interesting research being done in that. And back to what I was talking about earlier with chronic infections and development of autoimmune diseases, we know that people with an acute infection, people that have been hospitalized with a severe infection, I think it's over 70% of those people will go on to have a mood disorder if they don't address the microbiome and the health of the bacteria in the body. So bacteria play a huge role in your mental health as well. It's amazing.
Yeah. And it's just such a reminder. This entire conversation for me is such a reminder as to why, when we talk about holistic and it being whole, that we are not individual components, right?
Absolutely.
You can't just say, I'm going to treat the lungs because the lungs is having a problem, or even if it comes to things like just the foot, I'm not going to just treat the infection inside of the toe because you got fungus. It's connected to an entire body system.
Yes.
And I think that when people seek healthcare, they should really seek healthcare and be really inquisitive about your healthcare providers on whether or not they look at the body as a system or they treat individual components. That's one of the reasons why I personally love naturopathic doctors.
Yeah. I mean, and that's like this, that's the central part of our training. And that's not to say if you need a specialist for a particular area of your body, great. But I'm the kind of doctor that tries to put all the pieces together. And sometimes people have so many issues happening, you have to pull back. Sometimes I say the more complicated, I have patients that have 10 different organ systems that are involved. So you have to pull back and simplify and do exactly what you're saying, is treat the whole person. So we have to sort of heal the gut. We have to work on diet. We have to work on stress reduction. We have to work on mental health, stabilize you before we're going to say, take 50 different supplements, a Band-Aid for this and a Band-Aid for that and a Band-Aid for this. That doesn't work. That doesn't work.
Right.
So, I often use the analogy of an onion, right? Where you're peeling off layers, and you have to start with that most superficial layer. Where are you at now? What's the first thing that needs to be addressed holistically? And then we get down into more targeted areas that are more stubborn to recover. But that's one of the cool things too about the work that I do, is sometimes you do just the most basic foundational work, right? And you're not even treating somebody's migraines specifically, but you clean up their diet and then the migraines go away.
Right.
Or their PMS goes away, or their painful periods go away. I mean, I see it so often. So I agree. And this is why we're simpatico in what we're talking about, because, holistic is the foundation. And, this pandemic that we're facing right now, we're facing this really wily, scary virus that, we don't know exactly how. So you got to start with the most basic foundational pieces and prevent yourself from, getting to a point, hopefully, where you need to go to the hospital. And this is not to health shame anybody. We know that, people have so many different variables. There are very, you know, a number of reasons why somebody might become more severely ill. And, you know, just being elderly is one of the risk factors, right? I mean, we know that this disease has run rampant through nursing homes and elder care facilities. And that's because, you know, not just what you've necessarily done to your body over time, but your body just has less resilience, you know, and less amounts of antioxidants and, you know, the ability to recover. And that's what's really tragic about, you know, losing this whole generation of older people right now. You know, I know so many people that have lost grandparents.
We have only a couple of minutes left of the show. So could you leave us with a thought for something that people really, what would you like to see people do in order to keep themselves healthy? That's number one. And number two, let people know how they can how they can follow you, they can get your
definitely. Would love that. Would love that. So, you know, I think some of the things that we were just talking about, this holistic approach. I mean, I think stress reduction is just one of the most important things to stay healthy. I mean, a healthy diet and stress reduction are the two biggest. And you know, stress reduction looks very different for different people, right? You know, either you know, through meditation, prayer, spending time in nature, all of these things. You know, we have to find what works for us and what works for our lifestyle. I mean, I love to recommend simple things that are inexpensive, like tapping. I don't know if you're familiar with tapping, but you know, just changing your thought patterns and trying to find a place of peace and safety in your own body, which is challenging for a lot of people right now, really challenging. But I think that that is absolutely one of the most important things that we need to focus on. And you said as well, Mubarakah, you need to figure that out and spend concerted time, you know, finding what is going to really release stress in your body. And then, of course, you know, diet is the choices that you can make every day. Many people multiple times a day, too many multiple times a day right now at home. But you have a choice every day, you know, to strengthen your resilience, to strengthen your immune system, to prevent inflammation by the foods that you eat. So I would say those are the two most important foundational pieces. And then as far as people finding me, like I said, I've been in New Haven for over 20 years. I love the population that I work with here in the local area, but I also see patients. I'm doing all telemedicine, and I also see patients actually all around the country. So I can do long distance appointments as well. I hope to be opening back up in June to do acupuncture and craniosacral therapy, which is also part of my work. I miss seeing people face to face, but you can find me online on my website, which is just gingernash.com. And I also have a community of women, and I have a Facebook group that's very active. And we look at the intersection of women's health and culture, and that is called Feminology on Facebook, either on my personal page, Dr. Ginger Nash, or in my Feminology group. So I really, really appreciate the opportunity to share this information with you and your audience, Mubarakah. I love the work that you're doing as well. And people need it now more than ever.
Absolutely. Thank you. It was really informative. I am doing my bi-monthly grocery shopping.
Awesome.
Today. So I have I got my grocery list.
Good, good.
If you did not get your grocery list from this radio show, you need to re-listen.
All right. Yeah. And I can even throw a few more at you. Celery, green peppers, kale, Brussels sprouts, cauliflower,
absolutely.
Yeah. There's plenty. Awesome. What do they say? Shop the perimeter of the grocery store.
There you go. Yep. Shop the perimeter. So thank you so much.
Okay. Thank you, Mubarakah.
As always, I'm sure this is probably going to be one of our top listened to shows. And Great. So I want thank everybody for joining me. Remember, we are here every Wednesday morning at 10 a.m. We are streaming live from the Beaver Hills section of New Haven, Connecticut. I am Mubarakah Ibrahim, and you have been listening to Mornings with Mubarakah on WNHHLP 103.5 FM, New Haven's home for community radio.